Hi, Mark Murphy here, and I'm the lead faculty for clinical education at ProSomnus Sleep Technologies. And I wanted to talk to you a little bit this time about some of the little bumps in the road that I'll run into when I'm delivering a device. I wanted to talk about a couple or three things that will cause a little bit of discomfort for the patient. The first one that I run into occasionally is I'm delivering the device and I've got the tightness of the fit or the looseness of the fit, all of that's worked out, it's going in and out nicely, is sometimes the patient, when they're seating the device, will pinch the corner of their cheek back in the posterior. This almost always happens on the upper. And what that is this upper corner here is a little bit squared on all of the devices. Here I have an IA, a CA, and a PH. And that back corner of the acrylic that's wrapping around those second molars, it's got nice coverage on the buccal, but that edge up there is a beautiful place for some lax tissue to get entrapped and pinch the corner. If the patient does that, that's not a great deal of pain. There'll be a tiny bit of bleeding. And what I'll do is I'll just round or I'll bevel that edge down on the buccal corner. I'll bevel it down. I'll polish it back up with a rubber wheel, maybe some Sure Shine and some Preet 244, and that acrylic will look just like new. The second thing we'll come into is once in a while, a patient's coronoid process, instead of being flared out like this so that as the patient protrudes their mandible, it passes by any of the advancement posts or devices on these ProSomnus platforms, instead of passing by it, especially when they get forward 2 or 3 or 4 millimeters in titration, we'll once in a while see that coronoid process bump into the corner of the device or the advancement mechanism, anything up there. No problem. Again, now I bevel in a different dimension. Instead of beveling this way on the back corner for the soft tissue, I bevel the outside a little bit like this so that there's a little bit more room for the coronoid process to pass. The third uncomfortable situation that I'll see, not very often, but once in a while, is a patient who presents with the next morning or after a couple of 3 days that their ligaments or their jaw joints are a little sore in the morning. And if they're just a little bit sore and they're stretching, then we usually reduce the amount of time that they wear the device. Try wearing it 3 or 4 hours a night. If you get up in the middle of the night, take it out, wear it for half the night, put it in for the second half of the night if you didn't have it in the first half of the night, something like that, and they acclimate. If they're not acclimating, we'll consider backing them up. With the PH herp style device, with the CA jack screw device, continuous advancement, we've got the capability of moving them backwards 1 millimeter right there. Both of those devices are going to come to you at a 1 millimeter from their posterior most position. They will come to you delivered precisely at the bite relationship you gave us, but you have the capability on those two platforms of going backwards 1 millimeter. On this IA device, you don't quite have that. On this IA, the trick for you would be to order a -2 upper arch. The reason I suggest a -2, even though you might only want to go back 1 millimeter, is you have a lower 0 and a lower 1. So with a -2 upper arch, you could take the patient from 0, 0 to -1 millimeters with the upper -2, lower 1, and see how they feel. Usually that resolves. If not, go back to the upper 2 millimeter, -2, and the lower 0, and try them back 2 millimeters. I've been starting most of my patients around 50%, so we don't have any kind of temporomandibular discomfort very often, but when I do, I just back them up, start from there, and that solved the problem for me.